moving diagnosis and treatment into the community. Let's not wait any longer. Let's today be the day for change. Thank you.
Thank you, Mr Dowd. It's a pleasure to serve under your chairmanship and, might I say, a pleasure to see the Minister in her place. She's been a doughty campaigner for not only children's health but women's health over many years, and I'm pleased to see her in her place. And I'd like to thank the Honourable Member for Ipswich for bringing forward this important debate, and we share a common goal there, because I've been applying for a Westminster Hall debate on endometriosis since I arrived in this place. I'm delighted to see it finally happen, because endometriosis was a word that I grew up with in my house, because my mum suffered with endometriosis and ended up having a full hysterectomy in her mid-30s. And as a woman who is now in her mid-30s, I'm watching the cycle repeat, but with my friends. I'm seeing two of my closest friends being gaslit over a decade, being told, maybe it's IBS, maybe you're a bit of a hypochondriac. Have you considered a gluten intolerance? Could it be stress? How is your lifestyle? It's only now, after both of them, I'm very sad to say, suffered ectopic pregnancies, that they are now being taken seriously, and endometriosis is being explored for both of them, which will explain the pain they have both been in over a decade, for one of them 2 decades. And it reminds me of the constituents that have got in touch with me since I was elected. There was one mother who got in touch who had suffered from endometriosis, who took 9 years to have her diagnosis reached, and she said, my daughter is now starting her periods and I'm seeing the same thing repeat itself. She's showing the same symptoms that I had as a teenage girl, and we are going to the doctors, and I'm trying to advocate for her and I'm trying to fight for her, and we are being told maybe she's just got a low pain threshold. Have you considered putting her on birth control to ease the symptoms of her periods? And that's heartbreaking for that mother, because she wants to see, she's not fighting for herself anymore, she's fighting for the next generation of young women that she knows need to get that support as early as possible, so that their diagnosis can be reached and so that their treatment options can be explored as early as possible. I will give way.
Does she agree with me that for a lot of these conditions it's also vitally important that we have more research? So, for example, there could be a genetic link that is not explained yet, and it would make it so much easier for then daughters of women who had endometriosis to get much faster treatment and diagnosis. So research is also a vital part of the whole picture, isn't it?
I couldn't agree with my honourable friend more about research in general into gynecological conditions. I think if we invested as much into women's health as we have done over many decades into men's health, then maybe we wouldn't have so many different types of Viagra, and we might have a response to women's health. Clinicians, importantly, do not have to have specialist training in gynecological conditions when they go through their training. It's not mandatory. So it's vital to ensure that that training is available and mandated for all clinicians, especially those in general practice, because the most important thing that we can do as MPs is break down the barriers that our constituents face on a daily basis, and fixing the way that we perceive endometriosis as a country is one of the things that we can do, so that we can look back on our time here and think we've made a difference for women up and down the country. And I know that the Minister shares my ambition in this space to do better for all women. So I ask her today, what is the government doing to break down those barriers to getting earlier diagnosis for women suffering with gynecological issues, and especially endometriosis? Does she believe that there is benefits to having dedicated gynecological wards in hospitals? In my local hospital in St Richard's in Chichester, there is no specialist gynecological ward. Patients are put in lots of different wards depending on the procedure that they've had, which means that potentially they're not receiving the specialist aftercare that they could do with after receiving procedures. And finally, does she believe that all medical professionals should have mandated gynecological training so that they can give the support as early as possible to those that so desperately need it? Thank you.
Thank you. Liberal Democrat spokesperson Helen Morgan. Thank you, Mr Dowd. It's a pleasure to serve under your chairship, and thank you also to the Honourable Member for Ipswich for securing this debate. The opportunity for us to raise the importance of this debilitating condition with the Minister today is extremely welcome, and I welcome her to her place. And might I also say the contributions today have all been excellent, and she has been given a significant to-do list, which I'm sure she is equal to. Endometriosis is estimated to affect 10% of women. It's a condition that brings chronic pain, worsening physical health, and can pose a threat to fertility. It devastates lives and leaves many women excluded from education and employment. Thanks to the tireless campaigning of groups such as Endometriosis UK and the women in the gallery today, who I welcome, it's a condition that many of us are becoming increasingly aware of. Despite these efforts, however, the average diagnosis time for the condition has steadily increased since 2020. It now takes, as we've heard, an astounding average of 9 years and 4 months for women just to get a diagnosis, and that is unacceptable. This shocking amount of time just to get recognition of the condition is indicative, I think, of the wider issue of institutional misogyny and the dismissal of women's pain. And on average, endometriosis patients also wait 3.5 years from first noticing symptoms before seeking medical help, largely due to this normalisation of severe period pain. Now, awareness of endometriosis is still too low among the public and among healthcare professionals. 82% of patients have reported being told by their healthcare practitioners that they were making a fuss or that their symptoms were normal prior to diagnosis. And this, I think, is a recurring theme in women's health. For example, when I was involved in the birth trauma all-party group in the previous Parliament, we heard appalling testimony from women who'd suffered serious injury giving birth and were told when they went to their GP afterwards that, what do you expect you